Hi, I always get asked, what are the best supplements and vitamins that can help to treat and cure epilepsy with no side effects? I know everyone will love that treating epilepsy with something natural with no side effects, and in this video I'll explain all the supplements and vitamins to treat and help with your epilepsy. Welcome, I am your epilepsy specialized neurologist, Dr. Omar Danoun. The journey of discovering many medications always started with something natural in a plant or in a fungus or in a bacteria, and then we study this deeper and we find the active ingredients. For example, when we discovered the antibiotic penicillin, it came from a fungus, penicillin, and then this fungus was producing the penicillin to protect itself from the surrounding bacteria. Then we purified that, we did clinical trials and studies, and we extracted the active ingredient, the penicillin antibiotic, and we took it since then. So we don't eat a whole fungus when we get a bacterial infection, but we take a penicillin, the active ingredient. Here are the approved and clinically studied supplements for treatment of epilepsy. Number one is vitamin D. Vitamin D is essential in multiple reactions, especially in the bone health and calcium. So we know that lots of earlier and older anti-epileptic drugs can affect the bone health, such as carbamazepine, Tegretol, phenytoin, dilantin, phenobarbital, and valproic acid. They can cause osteoporosis on the long term and weaken the bones and causes fractures and broken bones. So we give vitamin D to all the patients with epilepsy to prevent this complication from happening. It is recommended to take anywhere between 500 to 2000 international units of vitamin D to protect the bones, and sometimes we follow the blood levels. If we have deficiency in vitamin D, we give higher doses at the beginning, and then we can supplement on the long term with the recommended doses. And yes, excess and lots of vitamin D and calcium can be harmful, so always take things into moderation. The second thing is folic acid. Folic acid is an essential vitamin in the fetal and baby development. So any woman of childbearing age, we recommend for her to take folic acid to prevent any potential malformations or effects on the baby, especially when she is taking anti-seizure medications. The baby will need the folic acid in the first 21 days of gestation or after the implantation, and this time is so early in pregnancy that the mother will not even know that she's pregnant. So it is better to have enough stores in the body before pregnancy starts, and that's what we do. We give folic acid to every woman. The dose ranges anywhere between 1 milligram to 4 milligrams, and yes, extra and too much folic acid might be harmful in some cases, so we always give the right amount of folic acid. Number 3, pyridoxine or vitamin B6. So pyridoxine is an interesting vitamin that there is an epilepsy syndrome, a genetic epilepsy. There is pyridoxine deficiency. So this genetic epilepsy, the baby will have a developmental delay, hypotonia, flabby baby will not develop appropriately, weakness, all of that, and the baby will have severe epilepsy because the brain is deprived from this essential vitamin. So if the baby has this condition, vitamin B6 supplements will help the baby to grow normally and pick up in the development. However, if the baby and the patient does not have pyridoxine deficiency, it is not recommended to give pyridoxine. Remember, if you're not deficient with something, adding it extra might not be helpful. On the other hand, extra pyridoxine can cause pyridoxine toxicity, which leads to neuropathy and damage to the nerve. So it is very important to take the right supplement at the right dosing. Number 4 is omega-3 or fish oil. There is a lot of hassle on omega-3 and lots of talk on that for its effect on cognitive function and brain development. In some studies with omega-3 found that there is some effect on anti-seizure properties of the omega-3. However, when we recommend anything, we have to prove that it is helpful, and we give it in moderate doses. So giving extra doses and mega doses of omega-3 might not be that useful, and we know now that omega-3 can be contaminated with lots of contamination in the oceans with mercury and arsenic. So it is better not to take too much omega-3. And there are some people think that omega-3 can help with the cognitive function. And in epilepsy, there are lots of people have issues with remembering and with their cognitive function, which I made a whole video about. There are lots of causes, not just omega-3, and there are sometimes the seizures are not controlled or the build of the brain is affected. So you can review that video for the full details. However, we should know what is the cause of the memory loss and not give omega-3 blindly. So my recommendation for you is to not take omega-3 regularly because of the risk of the contamination, and there is no highly valuable and highly reliable scientific evidence that it is helpful. Number 5 is CBD oil or marijuana oil. So CBD is an active ingredient in the plant of marijuana, which has hundreds of active ingredients, and CBD is cannabidiol is the active ingredient that can help to treat epilepsy. And there are some certain strains like indica and sativa, they have higher concentration of CBD that can help with epilepsy. And it is like any other thing you take, it does have lots of side effects. It's not a benign and natural, and you know that even natural things can be harmful. So we know that digoxin and digitalis can be having toxicity, and it's coming from a plant. And the most organic and natural things is like the spider venom or mushroom. They are pesticides free, wholly organic, but they can be very, very dangerous. So we have now pharmaceutical grade marijuana. It's in a medication which is 99% pure CBD called Epidiolex, and this medicine can be helpful in certain epilepsies, especially focal epilepsy and Lennox-Gastaut syndrome and those severe epilepsy. We have studies to prove that. And there are more things to say about marijuana plant and treatment of epilepsy, which I explain in its own video. Number 6 is modification of the food, which is called ketogenic diet. So the ketogenic diet is an interesting changes in the food that mimics the starvation or fasting state. We increase the consumption of fat and proteins and decrease significantly the consumption of carbohydrates, which will induce a state of ketosis, and that will increase the acidity of the blood and the brain, and that helps a lot with seizure control. And however, this can have side effects. It can be hard in the stomach. It can cause a decrease in the growth in children, diarrhea, stomach upset, and all of that. And it can cause some other metabolic issues in people who have genetic tendencies to metabolic issues with mitochondria and liver. So this ketogenic diet has to be under medical supervision, under the treating neurologist and under the specialized dietitian to plan the specific treatment. And now is the meat of this video, the natural supplements that are filling the market on Amazon and all the websites that they have a brain boost and all those natural supplements from the ginseng and from other plants and things that we don't even heard of or know. So here is the gist of this. The gist is that the overall this industry of natural supplements is not under FDA organization and FDA oversight, which means that they can put anything in those bottles and don't declare any side effects, and it is by design. They lobbied with billions of dollars to protect themselves from the oversight of the FDA, which is not a good thing, because we want to make sure that whatever is claimed to be true and the side effects to be measured, because it is not coming without side effect. It does have lots of side effects. Some people have liver damage, some people have some toxicity in their brain, or some contamination in the processing process because it's not tightly regulated. And all of those supplements on their website, if you go to their website, if you scroll all the way down after those shiny ads about very expensive bottles that they claim to help the brain, they will tell you that they are useless. In their own website, they will say this is not FDA proven treatment and it is not intended to treat any medical condition. So they are telling you that this is not helpful, but they still sell it and then push ads. So how do they sell them? They sell them by progressive ads and very aggressive marketing. And me as an epilepsy doctor on social media and YouTube, they will reach out to me and they send me emails of their very high commission rates, and they give me lots of money to talk about these in my videos. But you know me, I'm a professional. I'm a neurologist specialized in epilepsy. I do not give any influence by either pharmaceutical companies or all of those companies. So I only talk about my concepts and about my professional opinion and what are the medical and clinical trials and studies that are proven scientifically. I will not give you anything just to get commissions and money like others do. So if you have people telling telling you that, oh, they felt so much better on this medication and this supplements and things like that, and you can buy it in the link below, that means that they are being promoted, and be very careful when doing that. So epilepsy is a chronic condition and needs long-term treatment, and the field of epilepsy is rapidly advancing, and there are multiple exciting new treatments this year that I detailed in this video about all the new and exciting treatment that you have to see for the best advancement in epilepsy. And stay healthy, and see you in the next one. Salam.